You know, millions of people live with chronic pain every day. But what if, for a lot of them, the source of that pain isn't actually in their body, but in their mind? Today, we're diving into a really fascinating idea about why pain sticks around, and how we might, just might, be able to think it away. Let's get right into it.
So let's just start with the question that's probably on your mind. Why does pain sometimes hang around for months or even years, way after an injury should have totally healed? It's incredibly frustrating, it can be debilitating, and honestly, it's a huge mystery. And that's the mystery we're going to try and unpack today.
I love this quote because it just perfectly captures the whole idea. Think about it like a fire alarm, right? When you have a new injury, acute pain, that's the alarm going off because there's a real fire. It's useful, it's telling you to do something. But with chronic pain, the fire was put out a long time ago. The problem is, the alarm is just stuck, blaring away for no reason.
So first up, the lingering alarm. We're going to look at how that helpful warning signal can get stuck in a really painful and, frankly, unnecessary loop. Okay, before we go one step further, I have to stop and say this is probably the most important point of this entire explainer. We are talking about chronic, long-term pain. This stuff does not apply to new injuries. The absolute crucial first step is to always get a proper medical diagnosis. The source material shares this really chilling example of someone whose back pain was actually a tumor. You have to rule out any underlying physical causes before you even think about exploring this mind-body connection.
Right, but once you've done that, once the doctors have given you the all-clear on any serious underlying conditions, we can start to explore a pretty wild idea. What if the source of your pain isn't where you feel it? This is where everything we think we know about pain kind of gets flipped on its head.
The technical term for this is psychosomatic pain. And let's be absolutely crystal clear about something. This is not imaginary pain. It's not all in your head. The pain you feel is 100% real. It's physical. All this term means is that the signal is coming from the brain's emotional or memory centers instead of from, say, damaged tissue in your back or your knee.
So how does this even work? Well, this basically maps out the brain's hidden pain pathway. It can start with some old emotional memory, maybe something you've completely forgotten about, that gets tucked away in the brain. Then, maybe years later, some random cue in your environment, a certain smell, a sound, triggers that sleeping memory. That memory then wakes up and activates the pain center in your brain, which in turn sends a very real pain signal to a part of your body, even if there's nothing wrong with that body part.
And when you address this stuff, the results can be just astonishing. The source tells this story of a woman who needed a walker to get around for 20 years. But by working through the frustration that was linked to her pain, not the pain itself, but the emotion about the pain, that neurological signal just switched off, and she never used that walker again.
Okay, so if the brain can learn these faulty pain pathways, it begs the question, can it also unlearn them? And that brings us to our next section, rewiring the brain.
Here's another case study for you. A woman had this nagging, chronic back pain that she traced back to a car crash from 20 years ago. But when she really started to explore it, the problem wasn't the physical crash, it was all the emotional turmoil and the really tough life choices she had to make right after it. The moment she resolved that old emotional conflict, the back pain, it just stopped completely.
See, this is how people get stuck in this vicious cycle, what we're calling the pain loop. It all starts with stress and anxiety, which then triggers a real physical pain response. But then that pain creates a fear of future pain. And what does that fear cause? You guessed it, more stress and anxiety. And the loop just keeps going, getting stronger and more ingrained every single time.
So how in the world do you break that loop? Well, in Section 4, we're going to explore the mind's control room. This is a set of really powerful visualization tools that can help you basically take back the controls from these faulty pain signals.
Okay, this first technique is called the pinpoint. So instead of feeling pain as this big, overwhelming area, you use your mind to find its exact location. Then you imagine it shrinking down, smaller and smaller, until it's just a single pinpoint of light. And once you've got it isolated like that, you just mentally pull it out. The power in this is that it shifts your brain from being a passive victim to an active controller of the sensation.
Another really cool metaphor is the control room. You literally visualize a command center in your mind. It's got levers and dials for everything. Your heart rate, your breathing, all of it. And most importantly, there's a dial for pain. The source talks about a man who imagined his pain was at a level 9, and he just mentally reached out and turned that dial all the way down to a 1. It's all about reclaiming that sense of control. The metaphor gives your mind a handle, something tangible to grab onto. And the third technique sounds a little sci-fi, but it's called time travel. It's about mentally going back to a time before the pain ever started, really feeling what that was like. Then you project yourself forward into a future where you're healthy and completely pain-free. Now, this isn't just wishful thinking. What you're doing is giving your nervous system a blueprint, a reminder of what a pain-free existence feels like, a reality it might have forgotten.
All right, let's bring this all home. In our last section, we're talking about a new perspective on pain. Basically, reframing it not as some enemy we have to fight, but as a message we need to hear.
And look, this isn't just theory. The mind's power to heal is actually backed by research. There's a study with surgical patients, and the ones who used visualization techniques, picturing their bodies healing, they recovered way faster. How much faster? They cut their time in the hospital by up to 50%. That's huge.
And the truth is, your body already has this built-in ability to switch off pain. I mean, think about it. The adrenaline you get after an accident can make you feel nothing at all. Or have you ever been so totally lost in a movie that you completely forget you had a headache until the credits roll? Your mind is already an expert at this kind of thing.
So the big takeaway here is this. We need to completely reframe how we think about chronic pain. Instead of seeing it as just a physical problem, a malfunction, what if we see it as a message? It could be the body's way of trying to tell us that there's some unresolved emotional stress, or a nervous system that's just out of whack and needs our attention.
And all of that leads us to one last, pretty powerful question to leave you with. We've just talked about how the mind has this incredible power to create the very real sensation of pain. So, if it can do that, what else can it create? What about creating healing or well-being? It's definitely something to think about. Thanks for joining us.